It's so good to have everybody here today. We're looking forward to it. And before Erica, I go and introduce you guys and have you start, I want to call on Jim Patterson. Jim is, most of you know this, but Jim is the president of Stroke Awareness Oregon. And he and his colleagues put together an event last night that was unbelievable. I'm not joking. And my wife and I went to it. Had to go a few hours to get there, and it was so worth it. It was an incredible event. I'll let Jim talk in just a second, but before I do, I just wanted to call Jim out a little bit because even at the meeting last night, there's so much going on. There were tons of people there. Jim may have the number, but people got up and spoke, and you had speakers and stuff, and no one really gave Jim, I felt, as much credit as he deserves, because I know what he's done to make that happen. And so, Jim, I just wanted to say thank you. You did a fabulous job, buddy. And why don't you explain what we did last night?
Well, Keith, that's very kind of you. I appreciate that. And I know that my fellow stroke warriors and our folks in the medical profession feel the same way I do about the gratitude that we have, that we get in service to others. There's nothing that makes your heart more joyful than seeing others in the stroke community or the TBI community lifted up with hope and inspiration, and the sharing of others' journeys so that it's relatable. Last night, to celebrate stroke awareness, National Stroke Awareness Month in May, Stroke Awareness Oregon had the honor of hosting Mary and Randy Travis at an event we called An Evening with Randy and Mary Travis. Randy was born in Marshville, North Carolina, and Randy had a series of strokes while in the hospital for what was diagnosed originally as walking pneumonia, but turned out to be cardiomyopathy. And his stroke was significant enough that the brain was way out of alignment. There was swelling, and they had to take a portion of his skull off, which left Randy with the inability to speak, and he's still, to this day, unable to walk. He's in a wheelchair.
Oh, wow.
Some of you may have seen a couple weeks ago, through the magic of artificial intelligence, Randy was able to release a new song called Where That Came From. It's Randy's voice using AI, and the audience, we were close to 400 folks showed up, and as a result of our sponsor sales and our live auction of a Breedlove guitar, Stroke Awareness Oregon was able to raise a little over $105,000.
Wow.
Oh, good for you guys.
That is awesome.
Which is a big deal, because in order for us to be able to pursue our mission of providing people with hope and inspiration, and also to educate people on the signs of stroke, and that people are more aware of what the journey is like for people like all of us, the journey back to a quality of life. Randy and Mary shared their journey, and it was quite a journey. But what struck me the most was Randy was asked what advice they could give to people impacted by traumatic brain injury. And I just loved the response. The response was, the best therapy is to not be afraid to live life. Don't be afraid to live your life. They shared that, you know, they're doing things together now that they were not able to do when Randy was well and he was on tour. They now get to tour around together and go to other people's concerts, which is something they never had been able to experience. They're just living life fearlessly. And both of them made it very clear that that was one of the biggest and most important parts of their recovery and therapy, was not being afraid to live your life.
Love it.
So we were, you know, I hope that the people who came were as blessed as Keith and I were. I hope Kat enjoyed it. I know Harold did. Harold had a good time, and we have to thank Harold and his wife Kimberly, because they are a huge part of why Stroke Awareness Oregon continues to get the kind of financial support that we do through a company called Hayden Homes. They're an amazing company here in Central Oregon. They build homes in Oregon, Washington, and Idaho. And in the communities where they build homes, they have given over $70 million in philanthropy to small nonprofits and communities. So I'll tell you what, if you can get out and tell your story about why it's so important, this work that we do, it will resonate with people. And there's no better storytellers than stroke warriors themselves. Keith's a perfect example of that.
What's that?
You're a perfect example of that.
Thank you so much, Jim. That was awesome. It was an incredible event. And we could go on and you know, we will continue on our course here, but it was an awesome event. And Jim, I know, bud, that you and Harold, you know, thank you so much, Harold, for all you do too, buddy.
I don't do much.
Yeah, you do.
Yes, you do.
Yes, you do, buddy. You've given the ultimate sacrifice, frankly. That came out wrong. You guys know what I mean. I don't mean that in a bad sense. I mean that.
My dad gave the ultimate sacrifice. No reward. I like to do the Christ calf.
Because what?
My dad
Yeah.
made the ultimate sacrifice.
Yeah. Well, you have been a huge part of what's been going on, and we appreciate you, buddy. And I hope you know that.
Thanks.
Yeah, I hope you know it. It was so good to see you last night. So, all right, Jim, thank you so much, bud. It was
Thank
an
you,
awesome.
Keith.
Thank you, Jim.
You bet, Harold. Thank you, buddy.
Yeah. And of course, Jim, you know, everybody's kind of dressed up and looking good. Jim had to wear, you know, Jim and Michael are kind of alike that way sometimes, I think. What were you wearing, Jim?
I was wearing my orange and black t-shirt that said "Forever and Ever Amen" on the front of it.
Jim is a huge Oregon State University fan and a big member of all they do. And so everything is black and orange with Jimbo. All right.
And then there's Harold. Go Ducks.
I see it, Harold. All right, let's keep moving on, you guys. Sorry about that, but it was an awesome event, and so appreciate it. And I guess what the reason I wanted to call it out was because of the impact that SAO is having, and they've worked hard to get things going. And Jim is the president, and he's done a ton of it. So, all right. So today we have Erica Yorkowitz. Am I saying your name right, Erica? Yeah?
Yep, that's right.
Okay. And
glad you
she's
gave it a
got-
shot.
and three of her friends from colleagues, thank you, from Building
Minions.
Health. And just so you guys know, I mean, it was a late night last night, and then I had to get up and drive 3 hours to home. So if I miss a few steps, y'all know why, right? and next time I'll come up with another excuse. But anyway, so, Lindsay, raise your hand, Lindsay.
Hello.
Caroline and Shelby. They're all gonna help Erica, and we got a deal to show you guys. So take it away, Erica.
Oh, yes.
Well, Keith and I we've known each other for a couple years now, and I was really happy. I missed some of these meetings because, you know, of course it's 6 o'clock here, but I was happy to talk to him again and celebrate Stroke Awareness Month with you guys. I work at Novant Health, New Hanover Regional Medical Center. We're in Wilmington, North Carolina. I'm the post-acute coordinator for stroke. So basically, long and short is what I do is once somebody's had a stroke, I follow them afterwards and make sure that they've got what they need and try to help them get back to living their life, as Jim said, Randy said was so important to them. I think that's one of the major things and reasons why we do what we do and why it's so amazing how technology has improved over the years, because it really does allow people to come in and get treated and get back to living life again. And that's really all of our goals, right? The girls here that say Novant Health Neuro IR, I've known for a while. Lindsay was a nurse on the stroke floor. So I've known her for a really long time. And then Cece in the middle there, she came here a couple years ago from Duke, and she's been a great addition to our team. And Shelby is one of the IR techs. She's been here a long time. I think you're the first IR tech I've known here, Shelby, and she's taught me quite a bit. So I thought that rather than just talk about stroke, we could talk about some of the new things that we're doing for stroke and some of the interventions that can change lives and get you back to where you want to be if you come in as a stroke. So I asked Shelby and Lindsay and CC to help me come up with a slideshow. They really did it all themselves. They're fabulous, and talk a little bit about what they do and, you know, just kind of like what they see. There was a patient just this last weekend that Lindsay was telling me about, and I'll let her tell you about them, but you know, that came in and wasn't able to do anything sitting on the table. The procedure's completed and is able to talk and move their left side again. And that's, I mean, like changing right before their eyes. So it's fun to see that, and it's really meaningful. Do you know how to share do you guys want to add anything to that?
The only thing I'm gonna share, Erica, real quick is was asked the question, what is IR Health? And then secondly, when I share, I am expecting another person to come on, her and her husband. If you see it, would you allow them in?
Oh, of course. Well,
Yeah,
I mean, they'll have to, but yeah, they can do that.
I'm gonna share this now with you guys. Sorry about that.
IR is interventional radiology. Some people call it a cath lab, I think. Shelby's IR tech. I'll let her tell you everything that she does because it's really exciting.
So we are actually about 10 years behind cath lab. So if any of you are familiar with what the cath lab does with the heart, we are about 10 years in technology behind. These ladies right here, they are IR nurses, so interventional radiology, otherwise known as special procedures. These nurses have a big role in making sure that the patient's comfortable, and also, of course, monitoring their vital signs and making sure they get what they need. And then on the other hand, I am an X-ray tech. I went to school for X-ray and then moved to special procedures, where I run the X-ray machine and I help the doctor with products, and things that he might need during the procedure. Like Erica said, we're from Wilmington, North Carolina, from the coast, and welcome to our slideshow.
Okay.
I apologize in advance if there's anything that we put on here that is kind of redundant for you. We wanted to kind of keep it as simple as possible. We have put some of the things that we do into these slideshows, but of course, if there's like any questions, we would be happy to like explain further or go further into detail about some of these things. So here is a picture of our team. It consists of 5 nurses and 5 techs, and we have 2 doctors, which have specialized in endovascular procedures, is what we do. We are also known as small procedures or special procedures. Because we are minimally invasive, we do not do any kind of surgery per se. Our procedures are minimally invasive. Usually it is just a IV type stick, no bigger than the size of a spaghetti noodle or a pencil. We use x-ray and different types of wires and catheters and other kind of products to basically, we say, use the arterial system as a highway, whether we go through your arm or your leg, we use that highway system and our products to go to the arteries in the brain. This concept was surprisingly started in, like it says, 1964, but it actually didn't really start until the 80s, 90s that they started doing this for the brain. The first thrombectomy was actually done not until, I believe, 2006, 2007. So this is a very new, even though it's 10, 20 years ago, it's definitely a new technology that we're doing. As you may know, we have ischemic stroke and hemorrhagic stroke. Ischemic being when a blood clot is obstructing the blood flow to the brain, which is usually what our team deals with. We also have hemorrhagic stroke where for stroke, it's when the blood vessel actually bursts and causes a bleed. There's also other types of hemorrhagic bleeding that can be caused by an aneurysm or a what we call an arterial venous malformation, which is when there's an abnormality between arteries and veins. They can bleed. And so our team in particular helps treat those diagnoses. So brain aneurysms, any kind of brain malformations, we treat those who come in with those as well.
And then, no, the biggest thing that we can do is talk to you guys about prevention, obviously. I'm sure you guys are very aware of ways that you can prevent strokes now. But some of the biggest ways, we asked our doctors actually this last week, what is the ~1 way if you had to tell somebody in the public the best way to reduce your risk of stroke? And every single one of them hands down said stop smoking. That is going to be the biggest risk factor, is stopping smoking. Also monitoring your blood pressure, your cholesterol, eat a healthier diet. You want to exercise regularly. If you have sleep apnea, there's ways to treat it. Talk to your doctor about that. If you have diabetes, managing your diabetes, making sure that that is in a normal range, or at least on the lower end. Drinking in moderation, reducing stress, maintaining a healthy weight. Your brain is a good indicator of how the health and the rest of your body is. And so if you're treating the whole body, your brain is going to be happy and healthy as well. As far as treatment, so this is what we do. This is our bread and butter. This is our fun part. So like Erica said, we had a stroke patient come in. So what we do is a patient has a stroke and they come to the hospital. We assess what kind of stroke first. Is it ischemic? Is it hemorrhagic? If it's ischemic, meaning a blood clot or something is blocking the pathway to the rest of the brain. There's like a car crash on the highway, so you can't get to the other side of the highway. There is medications that we can give, such as clot busting medications, that will open up that highway, making the blood be able to flow more easily. And this is obviously a great medication. Works really, really well. Sometimes patients will come to our room and the clot will have resolved and we don't need to do our procedure, which is awesome. But that's not always the case. With those clot busting medications, it is also time sensitive. So once you arrive to the hospital from your last known normal or last known well time, being the last time somebody saw you without any stroke-like symptoms, is how we're based off of when we can give you that medication. We want to make it as soon as possible to the onset of your stroke symptoms, the better that medication works. After we get to so many hours, we can no longer give you that medication. That being a reason is because once that pathway is closed down for so long, this medication can make you bleed. So if once the pathway is closed, your brain already starts to reroute and starts to do things to help it out. If we open that up too late in the game, then it can cause a bleed. So mechanical thrombectomy is what the procedure that we do as nurses and techs. This is the physical removal of the clot in your brain. Like Shelby said, we typically make a small incision in either your wrist or your groin. We take catheters and use X-ray, wires, contrast, go all the way up through your arterial system. Like she said, it's a bunch of highway networks into the brain. We use an aspiration device, which we'll show you on another slide, to physically suck the clot out. And so that is what is the most rewarding part, because we actually physically get to see someone who was not moving their left side before, not moving their right side, wasn't able to speak to us, immediately be better and be able to move that side or be able to speak. Now, not every single case is immediate. Sometimes it does take people days or hours to get back to their baseline if they're able to get back to their baseline, but we still do get to see many, many cases that it is immediate and it's very rewarding. And then our last slide, we apologize for the blood. I should have warned you. So the first picture with the blood is a bunch of clots. So those were physically blocking the arterial system. Can you see my cursor by chance?
Yes.
Perfect. So this is where the blocked area was. This whole middle area is normally supposed to be filling with blood. This is what are the squiggles? So all the squiggles are your arterial system. So that is that network of highways that we talked about. This area should also be filled with that network of highway, and it's not, which indicates where the stroke is for us. So that stroke or that clot is sitting right here. We physically went up there, and then this picture is the aspiration device. We hooked up the aspiration device. It sucked the clots out, and those are all of those tiny clots that were blocking that pathway or that highway. And this is the after. You can see that whole middle area is now filled again. So this is what we call total revascularization, meaning that full blood flow is restored to the area that was once blocked. Now, as Shelby said, this is newer. The first thrombectomy, which is what this procedure is called, didn't start until around 2007, 2008. So definitely newer. Now, we did talk about the time-sensitive portion with the medications. A mechanical thrombectomy is also time-sensitive. We're able to do it after if the medication's a lot smaller time window. And mechanical thrombectomy, we can do up to 24 hours after your stroke symptoms start. So it gives us a little bit bigger of a window to be able to get that clot out and hopefully get you guys back to your baseline. And also going off of that, we have some national times that we've beat. I think the fastest time we've gotten so far is 4 minutes. And that's from the time from the doctor accessing your artery in your wrist to the time that we take that clot out of your brain, 4 minutes.
Wow.
So it's a pretty adrenaline rushed emergency procedure when the patient gets here. And as we say, time is brain. I think we say every minute that the brain does not have blood flow to that area, over 2 million neurons die in your brain tissue. So time is brain, and that's what we go off of. Like we talked about getting access, we have the 2 sites we normally go through. So we'll go through the wrist. That's our first line. It's the easiest for the patient, and it's just better overall. Or you might have heard of, if anyone's ever gone to the cath lab or known a family or friend that's gone there, they'll usually go in through their hip. So those are our 2 access points, and that's how we create our highways to get to the brain. This slide shows the aspiration and the different catheters we use to get the clots out of your brain. So this is a stent retriever. So this is a stent retriever. The doctor will bring this catheter all the way up to the clot, and it will sit. He'll usually keep the stent there for about a minute or 2 with the clot in it, and then it's like a corkscrew. Yep. Shelby knows this better than me. No. But she'll take it out, or they'll take it out, and that's where the clot comes and it like sits in that thing. So that's our clot grabber, I would say.
That's a good way. That's a good human way to say clot grabbing.
So we do a lot of education. Down on the left, we actually had a patient that came and visited us recently, and we love seeing this because we don't get to see a lot of our post procedures. So he came and walked in with his wife, and we had a great time catching up with him. And it's so good to see people on the other side of it enjoying their lives. And he had the biggest smile on his face, and that's this is why we do what we do, and we really enjoy it. We have a great little small team here in Wilmington, but we do big things for people, and we have lots of education we do online. If you guys have YouTube or Instagram, we have a QR code over here if you're interested in following along with us. But I'd also like to open up the floor if anyone has any questions for us as well.
This is Jim. I don't have a question, but I did want to share that as a result of my stroke, I did have an emergency thrombectomy, and watching this presentation was fascinating because I never really fully understood what the process was to go through that. And what I knew was the neurology team and the team of people like you folks did help save my life. And I want to say thank you to you on behalf of all the people that come in and get this treatment. You really do save lives.
Thank you.
Thank you. It's always nice to hear.
Jim, how long ago did you have your thrombectomy?
Well, my stroke was in July of 2020.
Okay.
It
We're
was July.
not- Go ahead.
It was July 11th of 2020.
One of the, I don't know how big of a program you have in your area, Keith. I think it's pretty large, but this is a really big deal for us because we have a neuro IR suite that's strictly neurology, strictly neuro procedures. And so they are not fighting for that room. If there's other procedures going on, it's completely specialized to them. Really state of the art. It's a really nice suite, but it's allowed people to, because we have this 24-hour coverage now, we can treat everybody here locally rather than send them up to, like, say where Michael is, you know, several hours away via helicopter, just wasting all of that time where they're not getting blood flow anymore. So years ago, probably 10 years ago or so, we were just sending people up, even less than that, sending people up to the Triangle area where they had larger hospitals and were able to treat them. But now, today, with our new IR suite and the neuro tower, people that come in, and we have a lot of rural areas around us, are able to be treated here. So they're saving time, they're saving brain cells, they're with their family. It's just a win-win.
How big is Wilmington area, Erica?
Oh, like population wise, I have no
Yeah.
idea. I can Google it.
Do
I
girls
have no
know?
idea, but we have, like,
Um,
Brunswick County is the
we're
largest
growing a
growing
lot.
county.
Say say that one more time. Caroline?
I don't know off the top of my head,
Sorry.
but we are growing tremendously. We used to be a small town, and everyone wants to come to the beach, so.
Yeah.
Eric,
I'm gonna
are you
look it up.
Googling it?
Because
Um,
Bend is not that big. I mean, it's growing like crazy. And there's a
Yeah.
lot going on, and so they're adding new stuff to the hospital all the time, but it's definitely, I mean, wasn't that long ago, it was only 110,000. Jim, do you know what the number is in Bend now?
The population of Bend is close to 90,000,
Yeah,
but for Central Oregon, it's probably pushing 150 to close to 175,000.
and that's still not that big, right? And so
No.
that's why I asked that question, because I wonder how big your guys' facility, how many people you guys have access to.
We
You want-
actually cover the entire east coast of North Carolina. We are the only area in our region that can do this procedure.
Wow,
We have
our
like a 9-county region. The
Wow.
population of
One would
Wilmington's 125,000.
okay. Beth, what were you gonna say?
I have a question, if I could. You guys covered really well ischemic stroke, but what if someone in your area has hemorrhagic stroke?
If they have a hemorrhagic stroke, we typically first try to see, the doctors at least, try to see what caused the stroke. It depends if it's in like a subarachnoid space, we can rule out if it's a brain aneurysm, or if it's a AVM, the malformation. Sometimes if it's just the typical, what they call an ICH or a bleed, it can be caused from high blood pressure. And we typically don't treat patients with hemorrhagic strokes unless they have a brain aneurysm that we can try to secure.
But a lot of times, we do diagnostic testing as well, and a lot of times those bleeds will come down to us. We'll get imaging as if we would during a thrombectomy, except this is an emergency situation. This is just purely diagnostic portion. We'll be able to see the vessels in your brain and be able to hopefully learn what happened and why it happened from that, so that they can go about the best course of treatment.
And how far
If
is
you
it?
don't, go ahead, Keith, I'm sorry.
I was just gonna ask, how far is it from Wilmington up to the other hospital that Erica was talking about?
The closest hospitals
150
that,
miles.
the closest hospitals that do the procedures that we do would be Duke and Chapel Hill, which are at least 2.5 to 3 hours by car. And then Myrtle Beach has a upcoming neuro program, but they're still 1.5 to 2 hours away by car.
Yeah, that's
And
a
then
lot.
to answer John's question about how common this treatment is, it's definitely becoming more and more common. Not every hospital does it. Like we were saying, we're the only hospital on the East Coast of North Carolina that does this procedure. But it definitely is becoming more and more common. We are just very lucky to be a specialized unit. So this is what we specialize in here. So we definitely do see it more down here. We do have some doctors that come from the north and say that they don't see it as often up there. But we see it quite often. Some weeks we'll have none. Some weeks we could have 10, 12 cases of just purely the thrombectomy.
If you don't treat hemorrhagic, do you send them all the way to Raleigh?
We treat them here. We have a neuro ICU that they will go to and they are treated there, but we can, in our area, we can't do any, like, typically we can't do any procedures that can treat them.
Our area being interventional radiology.
Okay,
If they
I
need to
see
go to
what
the
you're saying.
OR, they can go to the neuro OR.
yeah,
All of the hemorrhagic strokes are treated here. It just depends on what the cause of it is if they're gonna lower the blood pressure, reverse your anticoagulation, that kind of stuff. But everything is treatable here. It's just a matter of which place you're going to within the hospital. Does that make sense?
And sometimes
Yes.
hemorrhagic strokes don't necessarily need treatment, where ischemic strokes do. So they kind of differ a little bit.
And John, going off your question, does a patient usually have an MRI before to determine the vessel size? Usually this is really, really fast paced and the patient comes in from the ED, the emergency room, all the way to us within 20 to 30 minutes. And the doctors can actually look at the size of your vessels based on your CT scans.
Typically after the procedure or the next day, they'll get an MRI. But right before the procedure, it's just a CT.
I
That's
don't
a good
wanna,
question though, because it
Yeah.
is vessel dependent.
Yeah, we
This
have all
procedure.
different catheters in our rooms with all different sizes, and depending on the pathways and the sizes is what they use to do the procedures.
I don't wanna seem, redundant or the wrong thing here, but
No.
I mean, what you've explained, is it the newest forms of stuff? Is there anything coming down the pike that would be interesting for us all to know that you see coming that is gonna help these situations at all?
I think we are the newest and greatest thing for strokes right now. I only foresee this technology being faster. I don't know. I'm sure in 10 years it will, there'll be newer things for us. But right now, this is the newest and greatest for stroke treatment. It's a matter of, like we said prior, it's a matter of time,
Right.
and location and type of stroke, but we are definitely the newest thing for stroke treatment.
And 4 minutes is a fair, I mean, are you kidding me? That's unbelievable, frankly,
Yeah.
from my perspective. So,
Yeah.
Bev,
It's set records across the United States, so it's really cool to be a part of.
yeah, that's awesome. Bev,
Yeah, I had 2 hemorrhagic strokes and I have moya. And they didn't find that out until like 6 years after I had my first stroke. And anyway, I had many angiograms, and I think that's what you're talking about, right? Is the angiograms. And so, yeah, I've had way too many of those. But
Yeah.
now that I got my moya surgeries at Stanford with Dr. Gary Steinberg. And anyway, he made a ruling for me because I was turning 67 and he wanted me to come out and get, all the tests and everything, including another angiogram. And I said, no, I can't do that. And so he made a ruling after he got some MRI results from me saying, this is called Bev's rule. You don't have to have it after you're 65 unless you have symptoms. So, but I just celebrated my 25th stroke anniversary on May 8th from my first stroke. So
That's incredible.
Wow.
Yeah,
Good for you.
we do treat moya here. We don't see it all the time. It is more rare, as you know. But when we do see it, it's the imaging of it is very, very cool. Those angiograms that we're talking about. So that's a really cool story that you have to tell.
yeah, when I had my first angiogram, my whole left side of my brain was just a cloud of smoke.
Yeah.
And the right side had just a small narrow band. And the doctor said, unless I get out there quickly, I wouldn't be alive. And so I got out there quickly.
You know, whether we're talking to Bev or any of you guys, frankly, and then Randy Travis last night and Mary, it really shows to me that our own personal attitudes have such an important factor. I mean, I look at Gunnar there and Michael, and I mean, all of you guys, frankly, and having the right attitude can make such a huge impact on our health and growth after having a stroke. We've talked about, yeah, we've talked about it and talked about it. It's such a huge factor. Have any of you guys ever heard, just a second, Gunnar's up next, but have any of you guys ever heard of HHT? Erica, have you?
Yes, but I don't know
Yeah.
a ton about it.
Well, that's what I had. So, or have, whatever you want to call it. So it is a hereditary hemorrhagic telangiectasia. And that's how I got my stroke. And frankly, after my stroke, we did a bunch of testing. Not that you guys really care, but we've saved a lot of lives in my family because of HHT. And so I just wanted to bring it up just in case you guys, any of you nurses had heard of it or not. Just like Bev, it's a rare
Yeah,
thing.
I've heard of it, but yeah, I haven't heard a lot about it. So we'll have to ask our doctors about that actually.
Yeah, because a lot of people get misdiagnosed.
Yeah, I'm sure.
Nosebleeds are a real symptom of it. So anyway, go ahead, Gunnar.
Yeah, I just had a question. Does this procedure then preclude the use of any of the clot busting drugs to be used, the TPA that they used on me 8 years ago? I mean, I had a kind of a strange stroke situation. They say a piece of plaque came up and split into two and lodged into two places simultaneously in my brain. One in the brain stem, which should have killed me, took out my whole left side, and the other one in my occipital lobe, which took out the vision in my right eye at the same time. This came back in 6 months so I could focus again, and now it's 100%. This is a lot of work, but that was 8 years ago on April Fool's Day, 8 years ago. And but I wondered if they're not using TPA in conjunction with this clot removal anymore or what, because it's, you know, that's all they had at the time was to, and thank God they saved my life with that, with TPA.
We can use TPA. We have a new drug called TNK as well. And TPA usually ran in your IV over an hour. Now we have this new drug called TNK that all you have to do is push it and it's done and in the person's body in 5 seconds. And we can also use that in conjunction with our procedures.
Wow.
So do you do the clot removal physically and use this TDK, whatever it is?
Yes, and sometimes we get up to the brain and we take pictures, and the TPA has done its job. So we can back out and let the patient recover.
So you do administer the TPA before you start this clot removal procedure?
Yep.
Okay, that's what I was curious about, if they were still using that or not.
Yeah, absolutely.
And
Yeah,
all of
that-
this is done in a very fast mode.
Yeah, and then there is some times where like TPA, I believe you have to give it within 6 hours of a patient having stroke-like symptoms, where let's say someone's in the 7 or 8 hour mark where they can no longer receive the medication. Well, they can still come to us and we can still do a thrombectomy, where just also if you're in that 3 hour mark and you are able to get the TNK, you can also still come to us too. We just have a little bit longer window, so we can still help you in other ways if you can't receive the medication.
What kind of results? I mean, I saw in the beginning you were talking about the one person, but what kind of in general results are you guys really seeing because of all this?
It really depends on the patient and their history and whether they were walkie-talkie, walking around, living independently prior, or if they were, we've had patients that come in that have already been bed-bound, and sometimes they have a harder recovery. But like Erica was saying earlier, I had a patient over the weekend that came in, was having a stroke. We took him to do a thrombectomy with us. He was not able to speak. He had expressive aphasia. He can only say a couple words at a time, and he was not moving his left side. We did the procedure. I remember it took 7 minutes to get the clot out, which is amazing. And he was still having some trouble talking. And then just like that, it clicked. And within minutes, he was speaking full sentences to me and moving
That
his left
is
side completely.
incredible.
Wow.
That is incredible.
And he came to light completely. He was in shock himself, and we were showing him imaging and telling him exactly what was going on, and he just couldn't believe how fast everything happened and that he was getting taken care of. And thank goodness his wife is a physical therapist, and she was at home with him, and she noticed that he was holding up one side of his pants and he couldn't hold up the other, and she needed to call 911 immediately. So he got to the hospital quick, and we were able to help him, and he got discharged the next day.
Wow.
I told him yesterday he was out buying mahi, Lindsay.
He was fishing.
Out buying mahi for dinner.
Oh
He
my
was gonna cook
God.
dinner.
Good.
You- The other thing about that, just to mention, is I think it was you, Keith, that asked what the results are. And I mean, you know, today versus even 5 years ago when we weren't using tenecteplase, the medicine that you just push in. I mean, that, just think of all that length of time that you had to, that you went without getting complete medication. It took an hour for us to give that medication before.
Yeah.
So with the like the marriage of TNK and a thrombectomy and being able to do it all here in a suite where we don't have to wait for a room, it's, amazing how fast and how much better patients are doing.
Well, the other thing I wanted to just point out real quick, and I know we're kind of running up against time here, but, and, please forgive me. Are you Lindsay?
Yes.
Okay, so when Lindsay was talking, and she said independently and kind of your history and things like that, it really shows me that people's attitude as they're going through life and whatnot really does play a part in some of this, right? I mean, it's like if you believe that you're going to get better and you believe in your own ability to get better and get stronger, they come out and they heal so much faster, it seems to me. Do you want to remark on that?
I think it definitely helps to having like good positive outlooks, even when you're down. I know it can be really difficult, but if you can believe in yourself and also have good support around you, I think it absolutely can help your recovery.
Yeah, and like Gunnar, you were saying how you're still working on getting that movement back.
Yeah.
It's the fact that you're working on it. It will get better and better with time, obviously, because it's not like someone like you are doing better than you were prior to this, or once you had the stroke. But it's not always like our patient case that snaps and they're perfectly fine again. It does take some work, and if you're motivated, you can gain that strength back, which is really cool to see as well.
Absolutely. And then Gunnar, tell us how old you are again.
I just turned 70 in March.
Yeah. So
Happy birthday.
yeah, my point is that the game isn't over until we decide the game is over. And in that event last night, like Jim was talking about, it was so critically huge to see all the people there, all these stroke survivors, and listen to their story and how he never really went through much of a depression even. I mean, I did okay. I think most of us here have, but as soon as you can get yourself back and start looking outward and helping other people, you can really grow much faster. And it was just amazing to watch. And so any other questions for the girls or for Erica real quick?
I want to jump in real quick. I apologize for interrupting. I jumped on a little while ago. Now I feel kind of like a creeper for just sitting here not introducing myself. So my name is Scott Wilcox. I'm a stroke survivor. I live in Vancouver, Washington. I was introduced to Jim not too long ago. He gave me a connection to you guys. I'm excited to be a part of this and have enjoyed this conversation so far. You all know much more than I do, but it's been very interesting so far. So thanks for having me. I'm not sure how this really works, but I'm excited to hear these stories. So
awesome, Scott. And are you getting the notices from us of these meetings?
yes, I have them all on my calendar, and I'm eager to be a part of this and listen to this. It's what's interesting is I kind of jumped in the middle of this conversation. So I had the TNK, and then they tried to do another procedure, but I had a dissected artery and they couldn't get through it. So I'm guessing that it was the thrombosis or whatever. They could not get through to find the clot for me.
Yeah.
Well, you seem pretty sharp, buddy.
I got really lucky.
Yeah, it looks like you're doing well. So I'm glad hopefully the TNK did what it needed to do.
I think it did. Mine was on December 19th, and I was really lucky to be with someone who realized I was having a stroke.
Mm-hmm.
I argued like crazy that I wasn't, but she stuck with it. And I even argued with the 911 dispatcher because that's what we do. Thank God nobody listened to me.
Jim's stories like that too. And there's so many of us, and here's the thing, nobody knows about stroke, but I'll tell you what, SAO and all of you folks and Erica, you and your team and you gals, we're getting the word out there, and we're talking about FAST, and we're getting the word out. Jim knows SAO is going out to grade schools and talking about it. We do so much in the community to get the word out because it is making a difference. I personally don't believe in all those general numbers that are posted from the, whatever it's called, that says, oh, there's so many strokes and so many, no two strokes are alike. In all these meetings I've been running for a long time, for years, we've been doing this. There's hardly anybody who is like obese or anything like that. They're all different. Am I right with that, you guys?
Yep.
Yeah, I'll tell you one thing. Jim sent me the book, Say Yes to Life, where many of your stories are in there, and it's amazing to read some of this and read some of the similarities of mine and the mindset and things people are going through. It's crazy.
Yeah. Yeah. Well, listen, anybody have a stroke anniversary this month? Oh, let me unmute you. I apologize for that. I unmuted. Hang on. There we go. Oh, you may have to do that yourself, Jack. Anyway, Jack had a stroke anniversary this month. Awesome. Good to have you, buddy. Anybody else's in May? Bev, awesome. Yeah. Of course, some of you guys have multiple strokes, and so you get to add on months, right?
God forbid, jeez Louise. Multiple, I can barely handle this one.
Real quick, a couple more things. The next Stroke Warrior meeting's on the 28th of May. We're going to have Melissa Freeman, thanks to Michael there. She's going to be doing a new Jeopardy game with us. And let's see. Be sure to get that book that Scott was talking about, Say Yes to Life. It's a great book. If none of you have it, reach out to strokeawarenessoregon.org and get that book. I just want to say, of course, like always, I appreciate all you guys. Erica, thank you so much. You're a trooper. I just appreciate you so much. And you girls, and I can call you girls because I'm an old man.
They look like girls to all of us.
You're the best, girls.
Appreciate your professionalism and all that you guys do for the community. It's amazing, and we appreciate you guys very much. Erica, quit working. What are you doing?
I was typing an answer to this. Are you specially trained in radiology?
Oh, so you're working on our stuff?
Yeah, I was just typing the answer to it. I didn't want to make you guys go over your time. But I will say this, all of you can teach people be fast during the month of May because it's Stroke Awareness Month. And when you spot a stroke, they get to the hospital quickly. So that's a huge, huge piece of the puzzle. And that Neurovascular on the Coast page, whatever kind of social media you do, it's really informative. It's really informative. It's cool to see like all the vessels and the 3D technology that they use. So if you're interested in learning more, I think, or even being inspired and getting some good stories, I think it's a really fun thing to do. Lindsay, Shelby put the link on there, I think.
Yeah, it's in the chat.
But we appreciate you. You have a fun group, Keith. You guys are really positive, and I'm grateful for you to ask us to come and talk.
Well, we're grateful to have you. Seriously, there's a bunch of good ones out there, but I really appreciate that. Gunnar, go ahead.
Is there a listing or something that says which hospitals have this TMK and this kind of capability that you guys do to remove the strokes, to remove
Comprehensive centers would have the ability 24 hours, 7 days a week, 365 for thrombectomy. And then most hospitals that are primary stroke or acute stroke ready can treat with some kind of thrombolytic, whether it be TPA or TNK. Not everybody's at TNK yet, but most are getting there. So a primary center can treat with the medicine.
Do I just ask my hospital to see if they've got TNK or a thrombosis?
Yeah, you could just Google and see if they're like what kind of hospital they are, if they're a comprehensive center or a primary center. The choice to go from TPA to TNK is probably not going to be on their website, but as long as they can still treat you with one of those, that's a plus.
Right. Thank you.
You're welcome.
John, you have
All
a
right.
question?
Oh,
Whoever brought you, Erica, and the ladies to this meeting, if that was you, Keith, who found them, or if somebody brought it to your attention, please pass along thank you. This is really exciting. It's neat to hear there's something more. Would have loved to have known about this back when. But
John,
yeah, something to share with people who you know might have something happen in the future. Ask for.
Yeah. Mm-hmm.
Yeah.
Absolutely. Yeah.
John,
Family members to ask for. Absolutely.
real quick, I just want to call this out a little bit. So a few times ago, it's been a few months ago, I asked the question from everybody in the room, does anybody have any thing that they would like for me to go get put together? And Michael is the reason that I got in touch with Erica. And Michael has given me a lot of information, people to go see and stuff. I would encourage any and all of you, if you have somebody that you want me to reach out to, I'm not afraid to talk to anybody or go find them. So please let me know if there's something you want, and I will do my best to get it for you.
Well, thank you, Michael and Keith and everybody. This was just amazing.
Good. Thank you.
Thank you for having us. Yeah, thank you for having us.
I hate saying thank you to Michael, but thank you, Michael.
Thank you all for having me, including me. I appreciate it. Jim, thank you for the invite.
My
Thank
pleasure,
you, Michael.
Scott.
Oh, gosh.
Scott, I appreciate you coming on, buddy. We look forward to having you next time too, okay?
Thank you very much.
Before we go, can we discuss that meal allowance?
Yeah, we'll discuss that on, you and I will discuss that. I'll send you a peanut if I have to.
Scott, I will see you on May 30th.
Yes, you will. I look forward to it.
Great.
All right, you guys. Hey,
Feel free to reach out to us on social media if you guys have any questions as well.
Okay.
and how do we do that?
The link is in the chat for our social media pages.
Linktree.
Yep. So the
I'm gonna
link
have-
tree will take you to our YouTube, our Instagram. Our doctor will post some cool videos on YouTube, and then we post a lot of educational pieces on Instagram mostly.
Okay, so I will write that down because, I'm a little challenged on the Zoom thing. I don't know how to get all these notes.
Well, call Erica.
Erica, how do I get these notes?
Yeah, get in touch with Erica. as
Oh,
well.
they're all answered. I'll send you, we'll take a picture of the QR code because that's easy. I don't know if you guys know how to use a QR code, but it's super easy. I'll send you an email, Keith, and you can share it. How's that sound?
I appreciate you. I'm a stroke survivor too, you girls. So hey, thank you guys so much for joining. It was a great one. Appreciate you all so much. And
Thank you,
we will
Keith.
See you guys all next time. Okay.
Oh, gotta
Thank
go.
you for having us.
All
Bye.
right.
Bye, thank
Thanks,
you.
you guys.
Bye bye.
Bye, Scott.
Michael. Oh, he's gone. Bye, Keith. Thank you so much. I'll send you an email.
Okay, Erica. I really appreciate you. You know that.
Thank
Oh,
you,
I-
Erica.
It's mutual. I have an idea for you for another meeting too.
Love it. I
Sweet.
would love to
Okay.
hear about it.
All right,
So-
talk to you later. Welcome, Scott.
Okay. Have a great
Thank you
night.
very much, everybody.
Okay, bye-bye. Jim?
Say
did
hi to